This time I'd like to introduce Sean Hanna. He's the Senior Director of the Veterans Initiatives at the Meadows Institute. Prior to joining the Institute, Mr. Hanna served as the Director for Veterans Mental Health for the Texas Veterans Commission, and he played an instrumental role as the director. He played an instrumental role in building and supporting the military veteran peer network across the state. Mr. Hanna served 8 years in the Navy as a Fleet Marine Force hospital corpsman, where he deployed to multiple international locations and saw combat action in support of Operation United Shield in Somalia. I'd like to introduce Tim Keesling, who will be appearing online. He is the Director of Veterans Services Coordination for Texas Health and Human Services. Mr. Keesling previously served as the Director for Veterans Mental Health Coordination and Programs for Texas Health and Human Services Commission, the Director of the Texas Veterans Commission's Veterans Mental Health Department, and is the Assistant State Coordinator of Military Veteran Peer Network. Mr. Keesling is a retiree of the United States Army with over 20 years of active federal service and multiple peacetime and combat deployments. His military honors include the Legion of Merit, 2 Bronze Stars medals, numerous other service and achievement medals, the Combat Action Badge, and the Air Assault Badge. Next, I'd like to introduce David Pelletier as the Project Director for Justice for Vets, a division of the National Association of Drug Court Professionals, where he is responsible for assisting jurisdictions in the planning and implementation of veterans treatment courts. Mr. Pelletier previously served as a volunteer attorney and fellow at the Arlington, Virginia Public Defender's Office. Mr. Pelletier is a Marine Corps veteran who served primarily as a legal service specialist and a secondary role as a marksmanship instructor. Tracie is a licensed clinical social worker, an Army veteran who has worked for the Department of Veterans Affairs for over 16 years. She serves as the Veterans Justice Outreach Specialist for the Central Texas VA, working with 15 different counties as a liaison doing outreach and case management with justice-involved veterans. In her past role at the VA, she served as a long-term psychotherapist specializing in combat PTSD and military sexual trauma, as well as the primary care social worker for the Cedar Park VA Community-Based Outreach Clinic. At this time, I'll turn it over to the panel.
All right, thank you very much, Dave. And thank you, everybody, thank you. Thank you, it was good to be here. I'm sorry, we're just getting started. Yeah, and I think for all of you that stuck around, I appreciate it, and everybody joining us online. I couldn't be more excited. My name's Sean Hanna, by the way. I couldn't be more excited to be doing this and to be asked to be here. Just briefly, I'd like to say, the mission of the Meadows Institute is to provide independent, nonpartisan, data-driven, and trusted policy and program guidance that creates equitable, systemic changes so all Texans can obtain effective, efficient behavioral health care when and where they need it. And we include in that mission statement people who've gotten involved in the justice system. We want to make sure that they're being identified and that they're getting the care that they need. And today we're going to be talking specifically about veterans, but I want to make sure that we understand that we're talking about all Texans in our mission statement. There's a saying that I've heard within the veteran space that if you want to find the veterans who are not getting the mental health care that they need, just look in the jail or the cemetery, because that's where you're going to find them. And so we don't want to just talk about jails today, but too many of our veterans end up there with undiagnosed and untreated mental health and substance use conditions. So briefly, I would like to open it up to my panelists to make their own kind of opening remarks. Tell us about your organization, a little bit more than your bio had, and kind of the role that it plays within the ecosystem of veterans, particularly justice-involved veterans. And Tracie, I'm going to start with you.
Thanks. Okay. So I am the VJO for Central Texas. I serve 11 counties here in Texas. I am kind of new to the program, 6 months in, but let me tell you just a little bit about VJO. First of all, we are a prevention program, and we work closely under the HCHV program, the homeless program. Most of our veterans that are coming out of jail or are involved in the legal system have some component of homelessness. Either they've been homeless, they're on the verge of homelessness, or they are homeless. So we work under them, and we work with that team specifically. There's about 2009, the VJO program started. There are are nationally 400 VJOs in the nation. In Texas, we have about 30. So we currently serve in 601 veterans treatment courts and specialty courts throughout the nation. So we are getting bigger as we speak, which is a good thing because veterans are falling through the crack in the legal system. So a little bit about what we do. We work with the veterans treatment courts. We do not get involved in the legal portion of the veterans deal, but we help support the treatment court by working on the treatment team, giving treatment recommendations. Most of us are LCSWs, and we have a background in psychotherapy. We also assist in helping the communities build veteran court systems, and also in other aspects of the area. In Williamson County, we're working with the Veterans Court on doing a veterans pod. So those are the things that we are definitely involved in, and we try to put our input in for veteran services. I'm going to speak quickly to what I do during the day. So as a VJO, I get referrals from everyone. I get referrals from jails, probation officers, veterans court systems. I also use VRSS for those who don't know about it, and I know David will speak a little bit more to it, but that is the Vets Reentry Search Services. So I go on there every morning. I get alerted to veterans in my county who have been incarcerated, and then I start doing my work. I will either see those veterans in jail, I will reach out to their probation officers or whoever is working with in the legal aspect, because they're not all in jail in that. I link them up to services in the VA. Some are enrolled in the VA already, but some are not enrolled in the VA, and some do not want to be enrolled in the VA. So my job actually is to get them into establishing a relationship to want to use the VA as well, because after getting out of the legal system, that's going to be their best line of support system. So the VA offers tons of classes that can help the court system in, I'm trying to think of a word, in being able to, well, for treatment recommendations, we offer certain classes. We do PTSD 101. A lot of our veterans coming out of jail have post-traumatic stress disorder. They have military sexual trauma. We use substance abuse programs. We also do a strength at home class for domestic violence. A lot of them are involved in domestic violence. So, but a majority of the time we're working with the jails, with the liaisons in the jails, the jail diversion coordinators, linking them again to VA services, mental health services. Sometimes instead of working on sentencing with their lawyers, we're requesting or helping network with getting them into treatment programs, and that will suffice their, well, that will hopefully get them in the line of getting out, getting into treatment, getting them on the right road instead of going and getting sentenced and having to do jail time. So that's some of the things that we do. We work with benefits representatives. We have in Texas the Department of Disabled American Representatives. They help get veterans their benefits. I don't know if everyone in here knows about veterans benefits, but if a veteran has a service-connected disability, thank you. If something happens to them in combat, they can get benefits, monetary benefits, and also healthcare benefits. So one of the things that we really look at is getting them set up with their benefits so that they can get compensation for that. Because if they're homeless, because if they're low income, that's going to help them on the outside and obviously be better in getting them services and staying on the right track. So that's kind of the role of the VJO, linking to services, working with all of the legal systems, lawyers, probation officers, court teams, and just being that link to servicing our veterans, making sure they don't fall through the cracks.
Thanks for laying that out for us, Tracie.
Yeah, no problem.
Next, I'm going to David. Tell us about your work at Justice for Vets, kind of the mission of Justice for Vets, how you guys do your work, and then your specific role there too.
Awesome. Thanks, Sean, and thanks everybody for letting me kind of zoom in here. I am currently sitting in my basement in Prince George's County, Maryland. If you see me look to my right, it's because I have a very excited dog who, when he hears me speak, he thinks there's something going on. That's the picture over there, but if you see that, that's what that is. So as was mentioned earlier, I'm with Justice for Vets. We are a training and technical assistance division of the National Association of Drug Court Professionals. I've been auditing much of this conference, even though I have already satisfied my Virginia CLE requirements, and I'm not going to get any credits for this. I'm assuming, based on the conversations we've been having, many of you are familiar with NADCP. Justice for Vets is our Veteran Treatment Court kind of specific programming. I know in the last 4 years, we've been in Texas as an organization, NADCP and Justice for Vets, over 20 times, 8 of those specifically in the program that I run, which is our foundational training, our implementation training, working with jurisdictions, starting a program. And I know we've trained, we've done a number of mentor boot camps there as well. So I appreciate this continued relationship. Our goal, broadly speaking, is working with communities as they either establish, develop, enhance a veteran treatment court or other treatment court, collaborative court that may be working with the veteran population, right? So sometimes the need is not for a standalone veteran treatment court. It may be working within an existing mental health court or drug court and running a veteran track. And so how do we take those cultural competencies and bring that into that program? I really appreciate that we're following that risk conversation, because as we talk about veteran treatment courts, what we're really doing is acknowledging the responsivity need of this particular population, our cultural aspects of who we are. And I know, Sean, we'll get into VRSS and those kinds of things later, so I won't dig into it now. But we are here. I would say 90%, if not more, of the training that we offer, in-person, online, webinars, e-learning modules, whatever it may be, is all free to the jurisdictions. The training that I run is a 3-day intensive foundational training. In years past, we would travel to the jurisdiction. Now we're kind of doing it this way. We'll see how it looks like for 2022. But we work soup to nuts in helping a jurisdiction determine what does their veteran treatment court look like, staying within the research and the best practices. How do they apply it for their community so that it makes sense, and then building a program from there. So at this point, I'll leave it there because I know we're navigating kind of virtual and in real space, and we'll circle back around, I think is what they're saying these days, the kids.
Great. Thank you so much, David. The work that Justice for Vets does across the country is critically important. I appreciate you being here with us. Mr. Keesling from Health and Human Services, please, same thing. If you could talk some about your role at HHSC, as well as the broader kind of HHSC and its interest in investment around justice-involved veterans and veterans more broadly, so that we can have a scope of like HHSC's commitment to veterans.
Sure. Thank you, Sean. And thank you, everybody, for allowing me to be here this afternoon. I appreciate everybody sticking around this afternoon as well. So again, I'm Tim Keesling, the Director of Veteran Service Coordination for Health and Human Services Commission. My role is actually located within the Chief Program Service Officer. And I look across the agency to look at how we are providing services to veterans and seeing how we can do it in a more coordinated and effective fashion. So as the state's public health agency, we're focused very much on the medical, mental, social, and support system for the public health model of support to all Texans, and veterans being a fairly significant part of that subpopulation, looking at how do we provide those services broadly, and where do they intersect not just with other state agencies, but also with federal agencies that are operating in the state of Texas, with local communities and local governments in the state of Texas, to see how we can all partner and deliver the best services we possibly can at the time that the people need them. And we're just looking to make a positive difference in the life of Texans. As it relates to veterans, my role is fairly new. We've revisioned a lot of what I'm doing to look across this agency to see exactly where we're serving veterans and how we're doing so. One of the social determinants of health is obviously housing, and a lot of our veterans are impacted by not having appropriate housing, and we find a lot of those same veterans in the justice system. In prior roles, I've worked very closely with the justice system related to programming for veterans using the Gaines Center sequential intercept model, looking across the entire spectrum from pre-adjudication and engagement with law enforcement, and how do we make appropriate curriculum for law enforcement so that they can understand and better serve this population, maybe If they have the authority to do so, could they divert to the most appropriate facility needed to serve that person's needs at the time of crisis? Or is this actual criminal behavior and they need to go to a local county jail for adjudication or magistration, I should say. And then working, across that space, looking at, what happens at magistration. Do they go to the Veterans Treatment Court or do they go to the regular court? Is there programming in a court system like a Veterans Treatment Court to serve those specific unique needs? And how can that be supported by community? And how can it be integrated at the community level? And if that individual actually, gets adjudicated and winds up getting sentenced to a state jail or a state prison, what happens in those facilities and what's the support structure look like in those places? What happens when that individual is actually leaving those systems? And, are there systems in place to aid that person and make sure that transition, which is a transition kind of similar to military service, what does that look like and how does that integrate with community and how do we provide continuity of care across that space? And then, on the back end, if that individual requires community supervision for a period of time, how do we make sure that that system is working as well? And I think you're going to hear David talk a little bit more about the Veteran Reentry Search Service and kind of how that's kind of the tie that binds across all of that space and what it could be used for more appropriately to help really that entire system and have it be an informed system rather than kind of a system that might catch the population that we're talking about here.
Great, thank you, Tim. I appreciate that. The HHSC invests a lot of money in veteran services. They have a Texas Veterans Plus Family Alliance grant program that's $20 million per biennium that gets funded across the state. And I couldn't be happier and more proud of what our state health agency does for veterans and their families. So I got a question for the panelists, and David, I'm going to come to you first with this. Why are we talking about veterans in the justice system? Like, why should we care, right? I mean, it's like the justice system is there. There are laws. There are rules. People break the rules. There is a system in place to deal with people who decide that they're going to break the rules. Why do we need to talk about another special population that gets involved in the justice system like veterans?
I think, Sean, thanks for that. I think it's a valid question, right? And I think there are a couple of different answers to that. I think one answer is, you broke it, you bought it, right? You may hear some communities say, this is a population that at one point signed a blank check and, potentially as a result of their service, that is what drove or is the underlying cause of the substance use or mental health that may have then, created their engagement with the criminal justice system. And that's certainly a valid, kind of reason to think about it. I think organizationally for us at Justice for Vets, when we think about it, it really is about outcomes. What are we trying to do in the criminal justice system, right? Generally speaking, we're trying to reduce crime, keep the public safe, and, do it in a cost-effective manner. Well, by identifying an individual's kind of community, their culture, by identifying these individuals as veterans, we are able to do those things in the most efficacious and evidence-based way possible. We're able to bring in the unique resources of the VA, right? That may alleviate some of the county resources from the licensed mental health, right? I heard a number of presentations, we're rural, we don't have access to this, or we're missing this. Well, if we know this individual's a veteran, can we tie into telehealth to the VA or the vet center, right, and alleviate some of that? Can we utilize, as Tracie mentioned, Strength at Home, which is an intimate partner violence intervention, evidence-based, manualized, with phenomenal outcomes for the veteran population with intimate partner violence? Can we utilize that tool to reduce crime, right? Can we incorporate, we've heard the word community over and over again, right? One of the things about the veteran cultural identity, that military cultural identity, is that sense of community, is that sense of sisterhood and brotherhood, right? And so by identifying us, and in, for instance, a veteran treatment court, bringing us together, can we leverage the strength of that community, that cultural identity, to at times address some of the boundaries or barriers to getting help that same culture creates, right? For my fellow veterans on the panel and the ones in the audience, I'm sure you're familiar with the term "embrace the suck," right? Or pain is weakness leaving the body. And I can see, a couple of giggles, as odd as the virtual is, right? Or pain is weakness leaving the body. Yes, when you're in the military and you have a mission, those are appropriate things to help the military achieve its mission. You have to drive on. You have to suck it up and just embrace it and do what you need to do to accomplish the mission. When you're out, when you've transitioned, and that pain is an abscessed tooth that you stopped dealing with and never went to the dentist for, and so now you're self-medicating with alcohol, and then that becomes an issue that causes family strife or a job issue, and now you end up losing your job, right? And all of that stuff spirals, or an opioid addiction or whatever it may be, and you're involved in the justice system. Pain is weakness leaving the body, suck it up and drive on, doesn't help us get better. So how do we take that barrier so that we can improve these individuals' lives? And oh, by the way, we're the criminal legal system, reduce crime and save money. Well, a veteran treatment court or some other modality that is going to be best served with this particular population. So frankly, out of an obligation of service, that's great. But at the end of the day, if you look at whatever anyone's job is in that room, whether you're law enforcement, whether you're a judge, whether you're a defense attorney, right? As a former defense attorney, mitigating arguments for someone's, experience and what may be going on, knowing someone served. So it's critical to understand that part of these individuals in order to make the best decisions moving forward from an outcome standpoint.
Great, thank you, David. You guys want to add anything to that? Tracie, Tim?
So the only thing I think that's important to know or understand in the Veteran Treatments Court, we look at high risk, high need, and so we're always assessing the veteran's need on what services they haven't had if they're in jail, what they need versus if they're out of jail and they're in the VA system or not in the VA system. And so one of the things that we make sure is that high risk, high need, they're getting the treatment services that they need. We're pushing them to enroll in programs, working with their families. We can work with families. We can work with them individually. We have resources in the community that can work with their families to provide their spouses, their children with individual providers. So we're not just working with the veteran, we're working with the family. And if those veterans have a family unit, you have to make the unit whole, not just the veteran whole, or else it's not going to work for the veteran. So.
Tim, you want to add anything to that?
Yeah, and so I think it's really important to acknowledge, kind of the theme there is we're talking about the whole person, the whole person's experience here. So, if that veteran enters the justice system, what happens to them? What happens to their family? What happens to those benefits that they may have been entitled to through service and earned as a result of their service? Do they receive compensation and pension benefits? Were they receiving health care? Is there continuity for their medication management? What happens to that individual when they enter that system? And how do we make sure that transitions across the entirety of that system? And then what happens if that individual's, been served by the criminal justice system and is now getting ready to re-enter society? How do we appropriately restore benefit to them? How do we make sure that their family's prepared to receive that individual back? And how do we make sure they're a solid member of their community? And sometimes it's not a soft landing. So how can we do that effectively? And I think the ties there, and I appreciate you talking about the Texas Veterans and Family Alliance grant program. That's one tie where there's unique programming out there as a result of that. The mental health program for veterans is another unique tie to the community and to the criminal justice system, where folks are actually doing in-reach in prison systems and in state prisons and in county jails, where jails are coming up with unique solutions to create veteran pods and veteran peer support, where the state prison and state jail population are creating the same environments. And then importantly, as folks are getting to re-enter society, especially veterans who may have had unique, really odd circumstances for how they wound up in the justice system, as you heard David mention, some of that can be tied back to, who that individual was prior to service, but a lot of it can be tied to what happened during service. And if there's a good solid tie there, then how do we create that continuity of care exiting that system so that when the community receives them back, they know how to best take care of that person and their family? So I would certainly say that, as we look at this for me, kind of the tie that binds across this is continuity of care planning, continuity of care transitions, and those key transition points, and how do we inform those across the space to give them the best, health outcomes they can have, but also the best social adjustment outcomes they can have as well.
And Tim, I'm going to stick with you for the next one to start off on this, because you and I, both in previous roles that we had and working together, running and gunning for about the last 10 years, we did a lot of work in the justice system, right, at TVC and prior to TVC when we were leading the Military Veteran Peer Network. And can you run us through a little bit and just some examples? I don't need every county and everything, but from law enforcement to community supervision, just from your lens, and there might be something happening that we're not aware of, but from your lens, the things that are out there, starting with the T-Cole and those kind of things, like what, and I know you don't speak on behalf of other state agencies, you have your role at HHSC, but just kind of giving the audience a perspective of the different state agencies that are playing a role, particularly around justice-involved veterans.
Yeah, thanks, Sean. I really appreciate that. So, as you said, we've kind of been in this space for about 10 years, running across the state and across the nation at times to look at how to best serve veterans, especially justice-involved veterans or veterans that have mental health conditions. And as we all know, and again, I'm going to talk kind of specifically from the gain center sequential intercept model standpoint here and start at law enforcement engagement. When that first call comes out and that law enforcement officer has to show up to a scene, for me, it harkened back to, getting calls in combat. You're going to go on a quick reaction force, you go into the scene, and what happens as you're going to that call, you're supposed to be developing information so you know what you're getting yourself into. And it would be really great for, law enforcement to have a mechanism to kind of better understand who they might be engaging with in that community. And so, looking at that, we were asked to assist with curriculum development, Texas Commission on Law Enforcement course 4067, I believe it is, veteran, justice-involved veteran engagement for law enforcement, to give law enforcement officers an opportunity to understand better who they might be engaging with and why maybe not the normal mental health or behavioral health approach was going to be the most effective for engaging with trauma-affected veterans, especially combat trauma-affected veterans, because they might be, their responses to law enforcement might really be the opposite of what law enforcement expected, as far as kind of we're present, slow down, let's calm the environment through our presence, when that might be actually counter to what the situation required. So then kind of looking at that, how do we then transition that to what's happening in a county jail? And so there, there was some legislation a few years back that created an opportunity for county jails to better engage with who's in the county jail, who's coming through the system and coming through the doors, who's being magistrated, and how do we know anything about that population? And that was an opportunity for the creation of what's called the jail card that the Texas Veterans Commission is doing a great job of receiving that from the county jail, and having an opportunity to realize, hey, there's somebody in there. Can we engage with them? Can we work with the local veteran peer network folks, with the military veterans peer network across Texas, to engage in that county jail, get them in the door, maybe get a claims or benefits counselor in the door to see if there's some way we can connect with that individual, or on the back end, how can that individual reach out for local help once they've left? Maybe we didn't identify who they were at that time, but can we get them engaged with their benefits? Can we somehow help their needs that are likely related in some form or fashion to what's going on in their life at that time? For the individuals who don't have that opportunity to leave a county jail, maybe adjudicated, maybe found guilty. What happens to those individuals when they go to the state jail population? Working with TVCJ in the past, looking across their system, they wanted very much to be able to serve this population a little bit better, and so helped create a veterans pod in one of the state jail facilities that's specific to folks who have, served in the military, might have had some circumstances during their military that led to their landing in a county jail, or in a state jail facility, and understand that on the back end of that there's not going to be community supervision for those individuals for the most part. Those are individuals who are going to leave and might just land right back in the community. How do we help them kind of understand where they're at and tie back into those values that they had during the military? And then for folks who are in the state prisons, how do you create peer-to-peer programming? How do you get veterans to be veterans mentors in that system? And how do you have the system support that behavior. And TDCJ has done a great job of supporting that and taking that on. And then lastly, again, looking across the probation system and community supervision, is there an opportunity to engage with that population of probation officers and say, hey, let's figure out how you better engage with whom you are responsible for, so you can understand that maybe the reason that the individual is waking up at 5 a.m. every day and is looking for something to do, that might be tied back to years and years worth of ingrained behavior. Somebody was kicking them in the butt, making sure they woke up in the morning, and now they're having to do it themselves. And a lot of people are, culturally designed now or programmed now to be that individual. So if we can tie into those values again, maybe we can help them. And so, looking across that entirety of the system, how do we tie into, what the VJOs are doing? Very unique person sitting there to your left who, has the ability to really influence the life of a veteran at the Veteran Treatment Court. But how is the VA working to help that person? Are they engaged? Are they enrolled? We know a lot of veterans, for their own individual reasons, have chosen not to engage with or not to enroll in VA healthcare. But it is the nation's #1 and premier healthcare system for veterans. So how do we help those individuals navigate through that healthcare system that's really in their benefit, and help them understand that, kind of that VA of the past doesn't exist anymore. The VA that is here today is really designed for their unique needs. And then also, how do we help those veterans understand those state benefits that are available for them? Can we get them to a website like texvet.org, where they can, search for their own benefits and engage with them, making sure that they're informed. So I think as we look across the entirety of that system, and now I'm going to harken back to VRSS, I think we have a key opportunity here to utilize one kind of tie that binds using that system.
Thank you, Tim. Yeah. And that is where I want to go next with this. So I think we've made the case for justice-involved veterans and why we'd want to look at them as a special population. And it does help that you have the second largest federal agency. Is it fifth?
No, 5 minutes.
Oh, you're giving me a time back. I was like, no, it's not. It's second.
I'm sorry. You just.
So, threw me off.
I know, I'm sorry.
That's all right.
Yeah.
So, yeah, and so you do have that, right? In your community, you have the VA support, you have VJOs, you have the state of Texas making a huge investment in veterans. So there are a lot of resources and opportunities there to help a community better serve the veteran population. They don't exist for other populations. But David, I want to come back to you since you do so much work nationally and because we are short on time. The key point, the key thing I want everybody to take home is the Veteran Reentry Search Service and its accessibility for people who work in the criminal justice system to identify who are veterans. And so, David, what do you see across the country, like the best-in-class utilization of VRSS across the justice system, identifying these veterans? Like, what do you see, and what do you recommend?
Absolutely. No, thanks, Sean. And so for those in the audience who aren't aware, VRSS, Victor Romeo Sierra Sierra, it's Veteran Reentry Search Service.va.gov. It is what it sounds like. It's a website. It was initially designed to assist the VA in aiding veterans re-entering out of correctional institutions. Here's what is the unfortunately best kept secret. If you are in that sequential intercept that Tim so eloquently laid out for us, if you fall as an agency within that system, you can have an account. You can get a VRSS account. So Judge Keesling with the AOT model, somebody in your staff may be able to get a VRSS account. What it enables you to do is essentially batch upload up to 250 names at a time, essentially. It requires 6 data points: first name, last name, date of birth, social security, a unique identifier, so some case number or something that's unique to that veteran, and then a facility name and a facility location. And that could be the Bexar County Probation Department in Bexar County. Like that, those can be the locations. It doesn't have to be. It was originally designed for a jail or a prison, but it can be that vague. What that does is it ties into the VA's copy of the DoD rules. So somebody in the chat earlier had asked, well, what do you mean by veteran? For VRSS purposes, really what it is doing is, did this person serve on active duty? Is there record in the Department of Defense of having service? And I shouldn't even say active duty, because it's going to catch many Reserve and National Guard. And so it will return a result. The agency, the individual making that request, is only going to get that unique identifier back. You are just going to get 66543. And you're going to have to look at your list and say, okay, who was that? Your VJO, on the other hand, is going to get David Pelletier, 66543, 4 years, 9 months, active duty, 0 combat days, honorable discharge, right? So there's a lot of information already that you can start working with. I will tell you that many communities are just starting to get on board with this because it was so tied to the correctional system previously. The public defense community, many public defender offices are running their new clients once a week through VRSS and getting a roster of individuals who had military service, whether or not there's a veteran treatment court, right? Because the amount that level of information enables you to ask follow-up questions and do that is huge. Previous presentation, 200,000 individuals on supervision in Texas. You can run those through VRSS and you can find out who's on supervision, who's a veteran, which now means you can connect to your VJO, which means you can connect to the VA, which means you can bring those things to bear. So public defender's office, probation offices getting accounts, prosecutors getting accounts. I know we're on time. I'll give you two nuggets. Or one for time's sake. I just recently worked with an assistant U.S. attorney in Washington, D.C. She went to pretrial services and said, hey, how many veterans are currently charged with misdemeanors? And the response from pretrial services, well, it's probably less than 1%, so probably less than 40. She and I worked together to get a VRSS account. She got a VRSS account. She ran the 4,000 current misdemeanor cases through VRSS, and 3.5% returned. 142 individuals returned as having military service. So that's 102 new individuals that all of a sudden they were thinking about, okay, now we have a new piece of data, a new community to tie into, the VA to tie into, right? And they were able to start planning, do we want a veteran treatment court? Do we want straight diversion? What do we do with this information? And so incorporating something like that throughout the system, I think is critical. And only supports the work that we do at Justice for Vets in training communities to do a veteran treatment court. If you've identified the population, you can have a community that's got 10,000 vets. If none of them are getting arrested and none of them have significant supervision needs, maybe a veteran treatment court isn't the answer. Maybe it's something else, right? And so getting that data on the front end. But again, I could talk for days. My contact information is in all of the information you have. More than happy to do kind of smaller conversations with each community, but I'll toss it back to you, Sean.
And I just want to say something quickly. VJOs, we don't only work for veteran treatment courts, we work for the state of Texas. And so if any veteran, so if you are a lawyer, if you're a judge, and you come across a veteran who is not in VRSS or hasn't been enrolled, you can go on va.gov and Google VJO or type in VJO. Our website will come up. You can look at your county and you can click on our VJO name and you can send us an email. It generates an email. So we can reach out to that veteran, even if they don't want to be reached out to the VA. It's not like we're pushing VA services, but we just want to educate them on what we do have so that they know what's out there for them, and hopefully they'll want that support from the VA.
Great. I'm going to wrap with thanking my panelists and leave you all with, if you care about this subject and you want to do something about it. I know we only had 40 minutes, so that's not a lot of time to do it. We are all here, right? The Meadows Institute wants to help your community do better. The Health and Human Services, Tim's a resource for you. Justice for Vets is feel free to reach out, and we will meet with you and other decision makers and stakeholders and see what we can do to improve the system. Thank you very much for your time and your patience.
Sean, Tracie, Tim, David. This time, are there any questions for the folks that are still here with us in person? If you do have questions, please raise your hand so we can get a microphone to you, because the online community is having a hard time hearing those questions. And I don't see any hands up.
All right,
I'm going to ask
guys.
one real quick. How important are your local county veteran service officers or your veteran service officers from the VFW and the American Legion to you in hooking up local vets with the VA?
Yeah, I mean, the veteran county service officers, and we call them something different here in Texas, right? So it's the veteran county, so everywhere else in the world, they call them county veteran service officers. But the VCSOs here in Texas play a critical role at the county level in being a resource for veterans in that community. Now, you're obviously going to have a mix of relationships between that county service officer and perhaps a veteran treatment court or law enforcement, or, right, that's all. I mean, y'all live in Texas, you know what I'm talking about. Like, it can all be different relationships that are out there, but they play a huge role in the ecosystem of veteran services and a role to play in this as well. And Tracie, I'll let you speak to just in your local area here, the 14 or 15 counties of your what's your relationship with the county service officers? What does that look like? And of course, this is anecdotal, one snapshot, but what?
So if we identify a veteran who's not service connected, they are using, sometimes we can service veterans as an emergency. But if we identify veterans who are not service connected, we're definitely going to link them up. One of the great things about their role is that they can apply for benefits with the veteran. If the veteran is denied benefits, they can walk them through the process of appealing and working through all of that. So we try to definitely work closely with them so that they can get the benefits they deserve and they need to be able to use healthcare services. Because if you're a veteran and sometimes you don't have a service connection, you may have a copay, you may have to use the VA, you may not get all the services you're entitled to if you're not service connected. So being service connected, if you're entitled to it, is huge for us.
Mm-hmm.
Thank you very much, and thank you again for your service. And if you're a veteran in our audience today, thank you for your service as well.
Great. Thank you. Thank you.